Today, we're kicking off a brand new recurring segment, Smile Spectrum with Dr. Mandeep Johal. Why Smile Spectrum? Because in the realm of oral health, it's not just about the shine of your teeth, but the entire spectrum of factors ensuring a healthy mouth and, by extension, a healthy body. Dr. Johal is a proud Torontonian with a distinguished degree from Case Western Reserve University and a private practice called Family Dental Center in Guelph. She embarked on a deep exploration of dentistry triggered by a simple observation in her own child. Today, she's not only certified in laser surgery, but is also a recognized figure in several dental associations. I'm thrilled to have her on the show, and today we're kicking things off with a discussion about your kids and back to school. Welcome to the show, Mandeep.
Thank you so much, Candace.
So I am thrilled that you're here, and as we're stepping back into the back to school season, let's start with why is a dental checkup so crucial at this juncture right before school starts?
That's a great question. And this might surprise you when I'm going to say this, but it all is all about immunity. Okay, and we'll elaborate on that further, but it's all going to come down to immunity because you know how important that is the first month or two of school, especially for the little ones, so we can prevent some illnesses for them. I know people think teeth, cavities, and it's all related.
And the funny thing is, I remember when my kids were little, it was, maybe a week, two maximum before the sniffles came in the house. So I absolutely understand that. So where do we start with that then?
Well, first, so in our clinic, what we usually do is we screen our patients for sleep. From little kids to older kids, I want to know what's your quality of sleep like. And sleep is going to help with immunity. Now, transitioning from summer, like myself, I have kids, I have an 8-year-old and a 10-year-old, and our schedules are way off, right, with the holidays and, just the long days in general. Sleep. We got to get back into routine. We got to get our kids getting back to their optimal amount of sleep. My kids think it's okay to just, go to bed late, wake up late, and it's absolutely not. We need to get their, like young kids especially, need a minimum of like 9 to 10 hours of sleep, right?
Yeah, and I think if we have teenagers listening, they're going to protest this, but they need more.
They do. They don't realize how much change is happening in their body. So my advice to parents with teenagers is if they need to sleep in, do that catch up on the weekend, let them sleep in till 12, 1 o'clock. We all did it, but they really need that because the amount of changes that are happening in their body, and they need more sleep now than ever. That's the number one factor for immunity is going to be, I'm going to assess you for your sleep for sure.
All right. And you touched on something there too about, how everybody's sort of off of their routine. We followed a routines in the summer. That's just a fact. But we also tend to indulge a little more in sugary treats and beverages and, things like that from the fair and all those fun places we go. So any tips for parents on slipping back into routine?
So, wow, so many things come to my mind when we think of that because I just read something recently about how when we eat like that for the summer, it affects our immunity. See, remember I told you I was going to tie everything into immunity?
It's all going to go back to immunity.
It's all going to go to immunity. It affects our immunity, and it kind of sets us up because now we're hitting the school regimen again, and it is stressful. Change is stress, good or bad, is still stress. And then that affects, I know everybody's thinking candy, cavities, of course, because our immunity is down, our teeth and the insides are weaker. We're more prone to cavities, right? So it is all linked, but, getting our kids back on that routine and eating well and healthy diet, which we already know, it's gonna be important, but it's so hard in the summer. Just one more ice cream, mommy. One more gelato when we're out. Like it's hard.
And I know people are listening too, because again, this was me. So I'm not throwing out judgment. I'm just throwing out observation. Is I always said, oh, well, we're going to start routine, a couple of weeks before school. Never did. It was only when school started that we jumped back into it.
I know. So that's what I say, like, pick one thing. So in our household, what we'll do is you got to pick your battles, right? Like with kids, we all know you got to pick your battles. And for us, is like, I know the eating is going to be what it is right now. You got parties, you got gatherings, you got vacation. So, but let's try to focus on sleep as much as we can. Like, at least get that going. To get them trying to get to bed a little earlier. So that's what we try to do, just a little earlier every day.
And let's talk about nutrition.
Yes.
Again, here we go, because we all start off really, really great at the beginning of the school year and sort of fall right off near the end. But as we're heading in and everybody's gung ho, any tips for really great food to send in that are healthy for, overall dental health, not to mention body health?
Yeah, that's a great question. So I think I did a little post about this on my Instagram, or I did a story. When we do movie night at our household, I do indulge in like candy and stuff with my kids. Like I'm not going to deprive them of it, but we always try to have like celery and carrots mixed in. Do they dive to that first? Absolutely not. That's okay. But they know that that's going to be part of our setup when we're eating. Just having hard foods, because those things, like harder foods like celery and carrots, are also cleansing, right? So they're also kind of cleaning the teeth. Staying away from sugary stuff as much as we can. It's going to be important, especially if you know your kid's not sleeping well and they're starting to come down with something. Please try to decrease the amount of sugar that they're having.
And with the back to school comes back to sports. Anything we should be looking at there?
Yeah, make sure that their sports guard, it's because, kids are growing too, that you have a new sports guard. You can get that made. Pretty much like every clinic will do it. Especially for contact sports, it's really important for concussions and breaking of teeth. So, like in golf, hockey is a big deal here. So we really advocate for sports guards as much as we can.
And what else should parents be thinking about now as kids are heading back to school?
Well, when we touched on sleep, I wanted to elaborate on that as well, because what's up happening is we just think once a child is sleeping, they go to bed, they wake up, we're good to go. But what I do is I really want to dive deeper into that. What's your quality of sleep like, right? Are they mouth breathing? Because when we talk about nutrition, we talk about diet, it all comes down to, why do some kids get cavities and some don't, right? Some brush, some don't. And really, the commonality that I find is mouth breathing. I'm not saying your child is walking around with their mouth wide open. Like, Stranger Things. Have you seen that, right? It's
Yeah.
like an insult. So I'm very careful about it, not to put anybody down. Even seeping in air slightly. Does a child, like, I can notice when they're sitting in their chair, is a child sitting with their mouth slightly open, right? To me, I know that because their lips are drier, and they're chapped. That is a
Right.
telltale sign of mouth breathing. Now, that's going to lead to more decay and more cavities, especially at nighttime. So I think your question was about what else can we dive into. It's going to be sleep and mouth breathing, but are they also mouth breathing during the day?
And why does mouth breathing contribute to more cavities?
Great question. So at nighttime, if we think about it, what ends up happening if your mouth is open, right? Think about your lips are already dry. Your mouth is going to be dry too. So with a drier mouth, what you've done is you've decreased your pH. It's become more acidic. And now all these bacteria that thrive in this environment are going to break down your enamel a lot faster and cause cavities, especially in children because their teeth are so small and they're just more prone to decay. But that's essentially what it comes down to, is that environment that's created by the dry mouth. Your teeth are just more susceptible to breaking down.
I'm assuming that there is treatment for this.
Oh my gosh. Are we going to talk about it on this session?
Oh no, we're gonna have a whole other session, but I'm going to assume there is definitely treatment
Yeah.
for
Well,
this, right?
the other thing, like preparing for school for immunity, I would talk about, usually during the end of August, I usually bring this up with a lot of parents too, is making sure their noses are patent. Like if you notice that your kid's starting to get stuffy because of weather, I don't want to talk about it right now, but it is changing. Like it seems like fall like weather already, and it's mid-August, right? Is to make sure that their noses aren't stuffy. If you're noticing that your child has a little bit of stuffiness, the nose is running slightly, I am a big component on starting on nasal rinses. So the school year starts, I start my kids towards the end of the month of August, starting on the nasal rinses, and they're doing it throughout, just to keep the noses nice and clean. You touched on, I'm afraid to say this, everybody might not like this, but COVID, right? Surge potentially may happen come the new year of school, but we got to keep our airways clean and patent, right? When we started back when the clinic first started, when COVID happened, there were studies that were happening all over the world in like less developed countries where the number one way to keep symptoms at bay was nasal rinses. It was
All
amazing. There
right.
was a study done in Italy, in northern Italy, where they found that parents missed less work and kids missed less school if if they were doing nasal rinses every day. And these
That's
are
excellent
preschool and
advice.
elementary kids, yeah.
And totally accessible for people. So that's great advice. That's probably the best information I've heard in a while, actually, about that. So that's great. You're going to share more of this on our blog every month, whatshesaidtalk.com. So for all the things we couldn't get to in today's interview, you're going to put on the blog so people can go there. But where else can they keep up with you and connect with you?
On my Instagram at Dr. Mandeep Johal, I post lots of stuff on there. I actually have videos of my kids doing nasal rinses. I talk a lot about sleep, how to get our kids sleeping better, and what to look out for. You know, like, are they tired? You know, do they have dark circles under their eyes? Like certain things that we should be looking out for. So I have all that information on my Instagram page. Yeah.
All right. Incredible. We'll see you next month. I think we're going to be talking about sleep apnea. I can't believe it. For kids.
For kids.
Yeah. So that's a big one.
Yeah.
All right. Thank you so much for joining me today, and we'll see you next month.
All right. Thank you so much.